A couple of the others, there is up in Newcastle, we have the National Innovation Centre for Ageing, and it's a national resource. And so that's Newcastle University has really a depth of experience in research in ageing. But a couple of things that are really interesting up there in Newcastle, if you're bringing in a product to the UK, there's a network called Voice, which I know also covers the Nordics and Baltics. And it's like a citizens network. So you can get user testing of a concept or a finished product to be able to fine tune it before you launch it in the UK or elsewhere. And also in Newcastle, they have the Elders Council, which is it's local, but it's a way to be able to get feedback on what you're bringing in, on how it will be accepted. So that's the National Innovation Centre for Ageing. We have the Health Innovation Campus at Lancaster University. Now that it opened during lockdown, so they've had a bit of a difficult start, as I'm sure they're not the only organisation to have to face that. But what they do is they bring together stakeholders from diverse sectors to take a systems approach to solving problems at scale in healthy ageing and wellness. It's not one faculty, it's cross-sector, and they want to be able to engage with business and charities. And one of the areas that they're particularly interested in is challenges with housing. So they're actually engaged with discussions in several innovative housing companies. So again, just for information. So those are, say, three of the assets that we have. But I'm now going to see if I can unshare my screen. If I stop presenting, there we go. Stop presenting. So, okay, thank you. I think we're back. So I would now like to be able to hand over to Jason Brannan from, so Jason, if you're ready to go, I will just mute myself and let you go ahead.
Sure, Elaine, thanks very much. I guess first, can just make sure everybody can hear me okay? A thumbs up will be fine from anybody who's watching. Thank you, Sophie, that's much appreciated. Okay, well, hi everyone, I'm Jason Brannan, lovely to meet you all. I think it's been quite a stimulating event so far with some really interesting areas covered as well, which is great. I'm here to talk to you today about the Advanced Wellbeing Research Centre, which is the building you can see behind me. And I'm going to do that through a presentation just to make life easy. You'll see on my presentation, excuse me, you'll see my presentation, my contact details. Please do feel free to drop me a line. We're kind of open for business and we'd love to work internationally, which we already do with some really large global clients. But hopefully when I present, you'll see some more detail about what we're trying to achieve and what we've already got in place and really the sort of big change that's taking place in the UK healthcare market, actually. So let's see if we can get this thing shared. 1 second. Just sharing content now. This should work. Okay. Sorry about this, I've clicked share content and it doesn't seem to want to let me share. 1 moment, try that again. Let's dismiss that. Sorry about that all. I'm clicking share content, but for some reason it's not giving me the share options at the bottom. Elaine, do you think it's because I'm not linked in as the presenter or something like that?
I don't know. Has Dario got the presentation?
No, because it was too large for me to be able to handle it on my system. But let's see if.
I think usually the host of the group needs to approve that a guest like you or I can share.
That's what I was thinking. Yeah.
Gosh. Okay. So apologies for that. I didn't know, and I don't know where to look.
I've fallen in all these holes before.
We all, absolutely.
So where's it going to tell me that I can approve people?
This is a good question. Let's see 1 second here.
Well, actually, Dario, it's probably you, isn't it? Because it was set up at your end, rather. Even though I'm sorry, everybody. Technical questions, we get used to.
Oh, we'll get there. We'll find a way, I'm sure.
I wonder if Jason, if it might work if you leave the room and then join back again.
Yeah, happy to do that.
Like it happened once before, and then.
I'll do that now, Daria. Let's try that.
Yeah, if you try that, maybe, and if you were able to very quickly, try sending it to me in case I can share it.
Okay, I'll send you the link to the document now. I'll just leave the room 1 moment.
Yeah, so we lost Jason there, but Alain, I will send you the link as well to Jason's presentation. I think maybe you're able to open on your computer.
Yeah, if it's on what, you're going to send it to me by email? Daria?
Yes, I lost connection myself. So let's see, Jason is.
How are you sending it link to me? What I wonder is maybe what we could do is if let Ollie start, and then oh, hang on, I've got an open it. Hang on, let me see if this works. So do you want to have one more try, Jason? We can maybe go on to Ollie whilst we fix your presentation in the background.
Yeah, nope, I'm just trying now. Yeah, it looks like we've got the same thing again. It's just a spinning circle in the bottom of the screen. I've tried in a different browser as well and also on the app, but it seems to be the same thing. So I guess it must be a privileges thing. So
I'll tell you what, so why don't we do this? So if we'll skip to Ollie. If you're able to email me the actual PowerPoint rather than a link,
okay.
And I can open it online and we'll go back to you.
Let's give that a try. Okay.
All righty. Okay, thank you. So in which case, we can introduce Ollie again. So you're going to be talking about your experience in the NHS supporting digital health businesses.
Yeah, brilliant. Okay, and I'm happy to sort of take any questions from the chat if they start to come through. Obviously, I've already covered off a lot of the work that we're doing in Cornwall, and so I thought I'd just take this opportunity to provide a little bit of an overview to the NHS. And how that system works and how the money all starts to pass down, to give you a bit of an idea of the system. So we have the Department of Health and Social Care. They have an annual budget of in excess of £200 billion. That then gets passed down, a large chunk to NHS England, but also a significant chunk down to clinical commissioning groups. So these are the organisations that are responsible for decision-making around how regions spend their money. And those clinical commissioning groups are overseen through what they call clinical senates. So they've got clinical input and also have some support from what are called clinical support units that will help with business intelligence, etc., etc. So just to give you a bit of an idea on that, on the money side of things, £1 billion is enough to run the NHS across England for 3 days. So it's a massive scale. The average GP appointment in the UK is 9 minutes, and that costs the system £40. The NHS is there isn't a single front door. It's just squillions of different organisations. The workforce is over 1 million people, and there's 135 clinical commissioning groups in the UK, 223 trusts, so that's hospitals, and then there's thousands of healthcare providers, all of which are providing support to the population in England. So it is quite a complex picture, and as we've mentioned a lot on this presentation already, there isn't a single front door to the NHS. It's a sort of series of relationships and navigating the system while also working through the various different frameworks. If we could just skip to the next slide, please, Sophie. if that's possible. Thank you. The good thing is that in the UK there is political appetite to move towards these kind of digital health channels. We've had the Secretary of State talk about the tech vision for the UK being the most advanced in the world. Obviously, off the back of COVID, we've seen a significant uptake in digital technologies. At the height of COVID, we implemented what we call total triage for all of the various different primary care GP-facing services at scale. So that's already been implemented. So people have experience of online consultations, video consultations, etc. And that's led to a bit of a mind shift amongst patients that those channels can offer benefits, although there is still a significant way to go. And there is also continued investment from the UK government into health technology, large pots of money for AI, and then you've got lots of regional grants and funding that is available. Next slide, please, Sophie. I just want to draw your attention to the top quote, really. So we've talked about all the various different frameworks, from the digital technology assessment criteria and the measuring effectiveness of digital health technologies through NICE, etc. It's probably worth mentioning that despite the fact that you might go through those frameworks, there is still no mandate for proven solutions to be implemented in the UK. So unlike, let's say, pharmaceuticals, where you might prove that you can deliver at lower cost and better quality, and there's a mandate that needs to be in the system within a certain number of days, for digital health, it doesn't work like that. So you still need to make sure that you're working with all the various different networks throughout the region. So to do that, we've mentioned again that a lot of people will be talking about, okay, well, where's your evidence? Where are you working already? So it's really important to have some kind of practical source of evidence in the UK alongside many of these frameworks. I'm just going to touch again just a little bit on Cornwall. We have a fairly streamlined system. So unlike lots of other places around the UK where you've got multiple clinical commissioning groups and lots of trusts, we have one. So we have one clinical commissioning group, one NHS trust. We also have a large GP network that consists of almost 60 practices, GP practices, all of which are geared up to support evidence collection and real-world evaluation with patients and clinicians. Oh, I can hear someone talking in the background.
Right.
Oh, that's okay. We've got experience of working with a number of different digital health technologies from overseas, and Cornwall is a brilliant place to sort of soft land into the UK. So if you're looking at trying to prove your solution and then shout about it throughout the rest of the UK, Cornwall offers a really nice solution to be able to do that. But I don't know whether we want to go to Jason before opening up more of a sort of a conversation.
I now have Jason's presentation, so I can see if I can share that. Let me go on to share screen and see, has that worked? There we go. So can you see that? Can you see that on the screen now?
Oh,
Yes,
this looks promising.
Okay, is it full screen?
No, just slides at the moment, I can see.
Oh, hang on, here we go. That's full screen. Yeah? Have you got it full screen now?
Still slides at my end. I'm not sure about the rest of the group.
That's it.
Ah, that's it. Good.
That's it. Perfect. Okay, so if you just say next slide, and I'll do the business.
I will do, and thanks for arranging that, Elaine. It's much appreciated. I knew we'd get past the technological hurdle. We had it in us. Okay, so one thing I want to say before we get into the presentation very quickly, there's a major shift taking place in the way that the United Kingdom, and certainly England's looking at healthcare at the moment. We've had a system for a long time where the real emphasis and focus is on interventional medicine. So if something goes wrong with you, a hip fails or you get cancer, we intervene in that process, and we treat you with pharmaceuticals, or we put an implant in, or whatever that might be. COVID's kind of changing that to a degree. So there is a positive from this awful situation we find ourselves in. It's this. So we're looking again at how we look after our communities, working with them. And that's really looking at the whole concept of prevention in the first instance, and then resilience beyond intervention. So it's this wrapping around intervention with preventative healthcare and then resilience in the population. The AWRC, with the Advanced Wellbeing Research Centre, is a major centre set within the heart of the Sheffield City region in northern England. And it was brought about as a result of the Olympic legacy. So when we ran the Olympics in 2012, Olympic Legacy Park was created in Sheffield on the old site of the old Don Valley Stadium, which was used for the World Commonwealth Games, Student Commonwealth Games, sorry. And really, we were set up for two very clear reasons. Our vision is to transform lives through innovations that help people move. And we want to prevent and treat chronic disease, which you can see here. But really, that's about using physical activity within health and wellbeing as a way to do it. Next slide, please. Okay, thank you. I can see that now. The whole thing about physical activity is important. Without going into minute detail here, there's something we'd like to use an example. In Sheffield City region, there are a number of under-resourced and deprived areas. The place behind me here on my screen is a place called Darnall. It's one of the most underprivileged parts of the city. And what's important is we're looking at not just extending people's lives. That's a laudable thing. But we're looking to extend the healthy life years that they have, or the healthy life expectancy. And in our city in Sheffield, that's quite stark. So if, for example, you're sat where I am currently, which is not in front of that building, it's in southwest Sheffield, you've got a certain life expectancy. If you live in a place like Darnall, your healthy life expectancy is something like 25 years less. Now, in a modern society like Sheffield and the UK, that shouldn't be the case. So we want to affect that by using physical health and well-being as a way to do that. And it's a real grand challenge. It's something we need to change within our society. So we draw to the expertise from areas such as engineering, robotics, software, etc., in what is becoming a world-leading research centre here in the heart of Sheffield. Next slide, please. Okay. The AWRC itself, and by the way, just so you're all aware, I'm actually looking at the presentation on my other screen, so if I get ahead of Eileen's slides, that's okay. There are 5 pillars in the AWRC. We want to bring state-of-the-art technology into a centre, which we've done, and we have this incredible centre that's set up now. We want to provide access to research and design for global businesses, but also SMEs. So we work with organisations at pre-revenue stage, all the way through to businesses at a global stage, people like Canon Medical, for example. And the thing that I look at a lot of the time is how do we provide value to those organisations? How does AWRC work with researchers, work with businesses of a global and a local scale, and also work with communities? And that's the kind of thing that separates us, really. And we work with the community and industrial collaborators to co-design products. So we have a group, for example, called PIRG, P-I-R-G, and it stands for Public Involvement Research Group. And what that group does is literally uses community members to co-test products within the community. Next slide, please. We also act as an innovation centre for health and care services. So actually within the AWRC, as well as having world-leading facilities, so for example, we have one of the biggest motion analysis labs in the whole of Europe. We also have a whole clinical floor. So I'm not sure if you can see the building behind me at the moment, but on the 3rd floor there, the whole floor is dedicated to clinical work. So we have the NHS on site. We have physiotherapists on site, so both primary and secondary care as well, actually working with us. And what that gives us the ability to do is actually on-site validate technologies. And one of the things we've found real interest from actually globally is organisations approaching us to not just gain access to the NHS and our healthcare system, but actually validate their technologies on site clinically within the AWRC. As well as doing all that, we're obviously part of a major university, and we're one of the biggest universities in the UK. So it's a big institution, Sheffield Hallam University. But the thing that sets Hallam aside, I think, is we're an applied university. Even though we do world-leading research, we apply that research, and that's a real differentiator for us. So the things that we research, the things that we come up with, is applied in real-world scenarios. So we obviously support research graduates as well. Next slide, please. As I mentioned previously, the AWRC does sit right at the heart of the community. So next to us, we have a thing called the Oasis Academy. We also have, could you just go to the next slide, please? It's okay to skip this one. So we're right at the centre of the community, as I said, and we have a university technical college next door to us, and also the Olympic Legacy Park, OTC, and also an Oasis Academy. And so what that means is actually on site, we actually have students of all age groups right next to the AWRC. And that's really important because we believe healthcare shouldn't be done to people. It should be done with people, alongside them. So we research with our community. We bring the youth from our area into the AWRC, and we want them to see it as their centre. Now, why does this matter to global businesses? Because it gives you access to the healthcare system across the piece when you work with us. And I think that's really important for us. We've got 3 research themes that we coalesce around. Theme 1 is Healthy and Active 100, as you can see on the screen here. And this is this very real target that we have about being able to support people to live 100 healthy life years. Now, that's not just living till 100 years. You can live 100 years and have a pretty miserable last part of your life. We want to make sure that that life is both healthy and active. And this isn't just rhetoric. You know, this is real. On the ground, we're putting systems in place and developing technologies to make that possible. But we also work across the piece. So we work a lot with Public Health England, with the NHS. We work across with regional partners as well. And a really interesting thing to say is at the moment, within the Sheffield City region, the City region is currently looking to invest about £850 million into the work across City region to sort of elevate us, if you like. And part of that is to make a soft landing for international organisations. So how do we get organisations to come and invest in Sheffield to be part of what we do? And for me, it's about making sure that there's an equitable partnership. We provide as much to you as you provide to us. We give you access, we give you technology, R&D, validation, etc., etc. You bring to us really interesting technologies. Next slide, please. Our second research theme, as you can see, is living well with chronic disease. And that's really sort of looking at the role of physical activity and technology as well in the management and treatment of chronic disease. This is about therapy. You know, we don't, as I said to you before, we don't just want to do things to people. We want people to be alongside us. And there's a big move within the UK towards things called patient activation and social prescribing. And that's actually working with patients and communities to take control of their own healthcare. Next slide, please. This next slide slightly impinges upon some of the things that have been said before, but it's really about using technological and digital innovations to promote independent lives. The NHS understands in terms of its own sustainability agenda, certainly in secondary care and usually major hospitals and things like that, that people can't just stay in hospital beds. We need to free up that bed space. And we do that by giving patients the ability to actually, you know, spend time in their own homes and have treatment delivered in their own homes and actually take control of their own healthcare in their own homes. And how do we do that? The connectivity piece is huge. We've got to make sure that people are connected to each other and also connected to those healthcare providers, which drives their own health and well-being. Next slide, please. We also have a really advanced neurological rehabilitation research program. And this is particularly interesting, actually. I've been working with 3 companies recently who have been connecting into this program. And it's really interesting because they're looking at not only how rehabilitation can be done through technology, they're also looking at the patient pathway for that technology into the marketplace, into the NHS. So before that product hits the NHS, we've worked out the pathway, we've developed a pathway. So that whole thing about value proposition, validation of technologies, but also understanding how you fit within the pathway. Somebody said in a previous meeting about the importance of the NHS in terms of cost. Absolutely the same with many healthcare systems around the globe. But that core thing about how you affect patients' healthcare and also address the needs that an NHS trust, for example, might have is key. A very quick analogy. I know the director of procurement really well over at Leeds Teaching Hospitals, huge hospital, obviously based within our region. And he has a clinic each week, and within that clinic he brings the most interesting technologies that sees in the marketplace, and actually invites the people that run those companies into his hospital to look at those. Now that's quite a different way of approaching the same problem, but what he's always looking for is that idea of value proposition. How can you affect and change the issues he has? And most of the time they're issues based around his own people's own healthcare. So, try not to ever forget that. Next slide, please. A quick slide there shows you some of our global and local strategic collaborators and partners. We work really closely with these people. You can see we work with hospitals, the NHS, we work with global organisations. One thing to pick out here very quickly is we're also the research partner for the National Centre for Sports and Exercise Medicine. This is a national centre with 3 centres across the UK, and we do their research on behalf of them. But you'll see people like Canon Medical Systems, Parker and Westfield Health, so some really major collaborators. The reason I show that slide is so you don't just think this is a research centre for research's sake. We're absolutely applied, and that's key. Next slide, please. Could you just pop onto the next slide? Thank you. Okay, great, thanks. For the last year, we've been running a thing called the AWRC Wellbeing Accelerator Program. In lockdown, in COVID, we actually triaged 24 companies through this program and took them along their innovation pathway. Most of these were pre-revenue or early stage startup businesses. We're going to be running that program again from July, so that's open to SME type businesses, also global businesses. So we had companies from around the world. I'm told we even turned down a few companies from San Francisco. So we're obviously doing something right, weren't we, at that point in time? But what I must say on this slide, which is key, we deal with companies across the space. So we deal with companies from pre-revenue all the way to global businesses. And we have a really detailed, holistic business research support program in place for those companies. Next slide, please. As part of our efforts towards supporting COVID-19, we were employed nationally to run a program called Recover. And this is really about looking at, physical fitness as a preventative medicine, but also as a way to recover from COVID. So we're doing quite a lot of work in the recovery unit, actually helping people recover from COVID and actually doing detailed research on long COVID as a condition and how people can come back from that, which has been quite key, actually. As part of this research, we also put out something like 1.5 million documents to the elderly population across the UK. And that was really about sort of letting them understand the role of physical fitness and exercise in actually keeping themselves healthy and recovering from poor conditions, if you like. Next slide, please. We're also just about to start work on a really major cancer prehabilitation pathway program. I can't name the partner yet because it's a global partner and that's not been released just yet. But this is really about saying, okay, if somebody's going in for cancer treatment and going through the usual route of usual radiotherapy, chemotherapy, etc., we know it takes a toll on the human body. And actually to be successful and to improve your prognosis, if you like, the idea of prehabilitation is key. So we're putting together quite a major national prehabilitation program as well. So it'd be interesting people that can be a part of that. Next slide, please. You'll see here we're also doing some really interesting work on advanced human body measurement. You'll have all heard of BMI, body mass index, as a way to look at health and healthy size, if you like. It's a really flawed way of looking at people, although it is one of the best measures we've got actually at the moment. We're doing research on whole human body scanning as a way to actually assess body health and individual health. That's some world leading research we're doing at the moment, actually, with the technology we have on site. Next slide, please. We also have a very detailed AWRC systems change unit. So we look at the whole systems approach to physical activity, which I mentioned before, actually. And we look at different sectors, including the NHS and public sectors, to bring that together. Next slide, please. Some of you may have heard of this organisation. It's a national organisation now, Parkrun. You may have come across it. Parkrun is an incredible organisation because it uses physical fitness to drive well-being, but both mental well-being and physical well-being. We are the global research partner for Parkrun at an international level. And we actually look at the huge amounts of data that they create internationally, and we interpret that data and we find meaning in that data to drive people's health. Next slide, please. This is my last slide, so it looks like I'm pretty much on time, which makes a nice change for me. What we're trying to do here within Sheffield City region and also nationally, because let's be clear, we're a national research centre with an international reach. You can see my name up the top side there, Jason Brannan. Please feel free to drop me a line. The guy you see in the picture there is our Metro Mayor, and it's a new type of mayor across the UK. And these people handle devolved budgets for the whole of the UK. In many regions, that's now starting to be the healthcare budget as well as the education budget, etc., etc. But what Dan Jarvis, the chap you see on the bike there, is really spearheading is this whole idea of active travel, active well-being, and we're putting that at the heart of our economy here in the Sheffield City region. This is happening in the UK as well as a key driver. And this is this whole thing about making active travel, well-being, a driver for the future. If I want to end on one thing which I think is important, health and well-being traditionally has been seen as, I think, a bit of a soft area of healthcare, nice to have. It's absolutely essential. I believe that we have an opportunity, all of us around this table and people involved in health and well-being, to actually provide a generational opportunity to pass something meaningful and good onto our children and our grandchildren. We can make a real difference in our cities and our healthcare systems by creating resilience, by creating long, healthy life. So what we're trying to achieve is a really laudable thing. And I welcome any questions and I look forward to having a conversation with you all. Thank you. And back over to you, Elaine.
Many thanks, Jason. I think Elaine, you're mute. I'm aware of time.
There we go. Sorry, apologies. Yeah, sorry. It was. I'm just sort of trying to find. Can you hear me now?
Yes.
Yeah. Sorry. Yes, I know. We're right at the. We've got a moment left. So, Darius, do you want to ask people to? They can maybe submit questions that we can get back to them via our panel. Maybe that's the way to do it.
Yes. And I'm happy to do that. No problem.
Yes. So the contact details for all the speakers and as well as the website links to their websites will be linked on our website. We'll keep the websites up for the next weeks. So we will also be sharing the presentations there once the speakers will edit them and sort of and give us the let go for sharing them. So yeah, if you have any questions, do reach out to any of the speakers or to myself, and I can signpost you to the right people within the organization. So that's maybe the easiest way to go now. And I see that someone here already is writing that they will be in touch with you, Jason, or Cornwall. So I'm really happy to see that. And yeah, just to reiterate, and that the DIT is really happy to help innovation to the UK, and we look forward to working with you. And Elena, I don't know if you want to give the closing remarks for this panel.
Just to say, my role is within DIT, so it's liaising with people right across the north. So some of the speakers from this morning, and including Jason this afternoon. So and so between us, we're here to help you. That's what we do. Okay, so thank you everybody. Thank you very much, and I hope the rest of your day and your week goes well. And so thank you, Dario, for organising, and many thanks to all the speakers.
Many thanks, everyone.
Okay.
Thanks all. See you soon.